Welcome to the What's Happening Birmingham video podcast.
Hello, everyone. This is Jarvis S. Scott with What's Happening Birmingham. Today, I have the honor and pleasure. I think this is one of the largest Zoom recordings I've ever done. I never had almost like 5 or 6 people on here at one time. I feel very special. But I'm back with my good friends at the Birmingham Black Nurses Association to kind of talk about 2 upcoming events they got going on. So what I want to do, I want to first kick it off with just introductions by everybody. I'm going to start with my good friend, Teresa.
I am Teresa Rogers. I am the president of Birmingham Black Nurses Association. I am a retired nurse, but a nurse anyway, pediatric nurse. So that's enough about me. We have some important people on.
Next, you want to go, Tanya? Tanya?
Hi, good afternoon, everyone. I'm not sure about the important people, but my name is Tanya Gooden. I'm a women's health, board certified women's health nurse practitioner and board certified psychiatric nurse practitioner. I'm semi-retired for probably the last 5 to 6 years, but I'm working remotely now. And I'm glad to be here to talk about something that's dear and true to my heart.
Okay, and next.
And I'm sorry, I've been a BBNA member for the last 1 to 2 years.
Okay. And who's next?
Hi, I'm Javier Davis. I am also a member of the Birmingham Black Nurses Association, as well as a psychiatric mental health nurse practitioner.
And I am Jennifer Coleman, and I chair the mentorship program for the Birmingham Black Nurses Association, and I also chair the scholarship committee.
And I am Demetrico French. I'm a member of the Birmingham Black Nurses Association. And it sounds like I'm in a room full of important people. I'm a psychiatric and mental health nurse practitioner, board certified, as well as family, but I mainly practice psych at this time.
Okay, so I want to talk about this great event that you all got coming up on May 30th. It's an annual awards program, and it's about mental health awareness education. So who wants to tell me a little bit more about this? This seems really good program.
I am happy to talk about that. That is our annual scholarship and awards program. We provide scholarships to nursing students. And this year, our event is May 30th. And in recognition of May being Mental Health Month, our theme for our scholarship and awards program is focused on mental health. We will be at the Birmingham Botanical Gardens on May 30th. That's a Friday, from 8:30 to 3:30 for our educational program. There's a $50 registration fee, and continuing education credits are available for nurses. Our theme is mental health awareness and education, and we will talk about topics that are focused on patient care and nurse care, compassion fatigue, autism spectrum disorder, and others. Our keynote speaker for the educational program is Tina Brown. She is a national empathy educator, patient advocate, and inspirational speaker. And she is a brand ambassador for CeraVe Skincare. And Tina said she helps people develop empathy skills, in her words, to build a more compassionate world. She will, on Friday, May 30th, she will speak with us about her workshop that she titles Renew, Restoring Every Nurse Everywhere, RENEW. And it's a nurse well-being workshop that's provided by Sarah V Skincare. She'll speak on a healthy work environment, preventing burnout among nurses, giving and receiving feedback. She'll talk about self-compassion, self-care, mindfulness, and she'll also speak on the benefits of empathy and compassion for the provider and the patient. So again, this is an educational program on May 30th at the Birmingham Botanical Gardens, 8:30 to 3:30 p.m. You can register at the door, or you may mail your registration to us at Birmingham Black Nurses Association, P.O. Box 13856 in Birmingham, 35202. You can also go to our website, birminghambna.org. Our flyer is posted on our landing page, and there's information for other options for registration. So we're hoping to see everyone on May 30th at the Birmingham Botanical Gardens.
Well, I've never thought about that before because, I guess especially with you all profession, you all work, of course, long hours, and long hours lead to a lot of burnout and just the stress of the job that you all do. That sometimes you all need some, special care yourself.
Exactly. And her workshop focuses on nurse well-being.
Uh-huh.
So we're excited to have her come to Birmingham with us that day.
Okay, and I see you all have another event, the Men of the Birmingham Black Nurses Association Barbershop Talk.
So June is Men Health Month. So we will be focusing on men only. This workshop is for men. We're encouraging teenagers to come out, men of all ages, men from everywhere. And Dr. French, you may want to give more information about that. He's on that committee and we're pulling that together. It is going to be on June 7th from 9 a.m. to 12 noon. We'll be talking about all sorts of issues where men can just talk among themselves. It is not for females, but if women want to come, they can. To be there supportive of their husbands. A lot of time men won't go to a doctor unless their wife go with them. So, but it is for men, honest talk about mental issues, even marital issues, children with men who have children. And if they're having problems with that, it's just a way to have honest talk. Anything you want to add to that, Dr. French?
You said a mouthful, but basically a relaxed environment for men to get together and have conversations about certain things we face that we typically may not want to talk about to our spouses or our significant others, but just to destigmatize the mental health in our community and to just open it up and allow us to be ourselves and learn and gain experience and pray for this could continue year after year so we can continue to grow as a community.
And like I said, yeah, this event is free.
Yes.
And I see, UAB Center for Psychiatry. I don't know. I thought at first it was a local barbershop, but I saw the barbershop flyer. That was really neat. So with these two events that's coming up, what goals do you all want to achieve from these upcoming events, as far as for the profession and also for the community?
With the scholarship, with the educational program at the Botanical Gardens on May 30th, we would just like to bring awareness to mental health care and try to do away with the stigma and encourage everyone that mental health care is available and that it is something that we all need. So that's our goal, to educate everyone about mental health care and just take away the reluctance to seek care.
And the same thing about the barbershop talk as well is to destigmatize mental health, especially with men. Like we could be going through so much and we don't realize that it's affecting our mental, physical, emotional, spiritual, just the holistic aspect of our life to we just continue going about day-to-day activities until we get to the point we explode or we shut down, and that's not a way to manage your lifestyle, just manage you as a person. So the barbershop talk is to be is a relaxation environment, relaxed environment for us to get together and just let all men know that it's okay to talk about your mental health and to uh just open up and be transparent, so we can continue to build our community, and that's what our community lack is that. So if men could get together and open up and talk about their mental health, then the family will blossom.
And
Okay.
just to add to that, Dr. French, I always applaud my male patients when they come forth for counseling and therapy, because we know just due to culture norms,
Yes, ma'am.
uh, in the Black communities, discussing mental health seems a stigma and taboo. So, as African American men, they feel the pressure just to be strong and not talk about the challenges they face every day in society. So they suffer in silence. So I think even though we're not gonna be there and not invited, I want to say I always applaud my male patients that come forth just to be more vulnerable and open up, and that will open space for other African American men to discuss amongst other men who may have similar challenges. Also, they may have boys that are coming up, and that's an open discussion that they need to have with their children.
True, so true.
Mhm.
All right. Well, does anybody have any final thoughts or anything they would like to add? Um, I always want to start off too, and Teresa know this. I know you. I've had several interviews with your organization, but for everybody that's sleeping under a rock, Teresa, can you just tell more about what your organization does? Because I love what you all do because it's a much needed profession and shine light on something special in our community that as everyone gets, I would say get older, but everybody at some point is going to be in the hospital. And it's so important to have somebody that kind of looks like us to relate with us because that means, a lot as far as getting back to well-being and health.
Well, just to mention our mission, we're here to address health disparities, prove access to care through education. And so the events that we're doing is to provide education to our communities. And it's also professional development for other nurses. And then we are encouraging community engagement. So every time you see us out at a health fair, that is part of our community engagement. But the community that has health fairs, they are being engaged. And a community that has more engagement, the health of that community is improved. So our role is just to make a positive impact on healthcare and empowering the next generation of nurses. But Ms. Javere, you hadn't said anything. Everybody has said something except for
No,
Ms. Javere Davis.
yes. So just piggybacking off what everyone else is saying, that we just want to create a safe space that we can have open and honest conversations, free from judgment, breaking down barriers with the stigma. We know religion can kind of sometimes get in the way, and so us being open and seeing other people coming forward to receive the mental health treatment that they need, it kind of gives the community a boost and say, okay, this is okay. I don't have to feel shame in opening up with other people.
And let me just throw this in. This is Nurses Week for everyone across the nation, May 6th through May 12th. But this is also Mental Health Month. So as an organization, we're celebrating the Nurses Week, but we wanted to highlight mental health during this week, as well as the whole month.
Okay, well, I want to thank you all for coming on to kind of talk about these two important events. And like you said, mental health is very important. And sometimes, like in our community, sometimes we just go in and say, just pray to Jesus. Yeah, that helps too. But sometimes you just need to have a listening ear here that's here on earth as well.
And maybe
So,
a pill.
yeah,
Yeah,
yes,
that's what we normally, especially in the Black community, we always say pray. I mean, pray is great,
It's
and God
great.
put people in our lives to help him. Like he sent angels out there, and if he's using us professionals, mental health professionals to help the community far as either his therapy or his medication management, I think it's a good thing. But most definitely don't stop praying. You gotta pray. That's key. I speak religion to my patients all the time, and whether they believe in God or not, but I ask them, do they? But I have to put my heart out there and let them know that you most definitely need to pray first, which is vertical, then speak to your peers, whether it be a professional, someone you can trust, a family member, and you talk about what's going on in your life, because it does only affect you, it affect the ones that surround you, like your family, your spouse, your kids,
yes.
your co-workers. It can spread like a disease, so you most definitely need to take care of yourself.
And to add to that, Mr. Escott, we place a lot of importance on maintaining our physical and spiritual well-being, but from a holistic approach in treating our patients, we need to maintain our mental health because it's all is one. Because our mental health is crucial and really has posed a critical issue in our community. And it's so important that our mission also from BBNA to the Black community is to make sure that we are providing diverse, culturally competent providers. Patients want to see people that tend to look more like us.
Yes, ma'am.
And that creates a more positive rapport. And because when they see people who look like similar to them, they will share similar experiences and their challenges. So that's one of the mission and visions of BBNA is for the education, mentoring, and also putting a face out there to others who are coming up.
Yeah, I think when us in our community, when the provider look like the clients, the patients, whatever, they can be more relatable. And it's like you said, it's easier to open up when you know someone
Yeah.
who could possibly been through what you've been through and understand your turmoil, the things that you're struggling with. So that plays a major part in it. A major part in it.
And
All
I
right.
just wanted to showcase our mental health specialists. We have them in our organization, and this is just a few of them, but our focus this week was on mental health.
Okay, definitely got to keep you all's mental health up because if you all go, oof, with the patients, so we got to definitely keep you all, this child, I know it can be stressful. Well, thank you all for coming on today. I always appreciate the work you all do. Thank you all for watching. Please check out What's Happening Birmingham for more interviews. Don't forget to subscribe to the YouTube channel. I'm on TikTok now at Happening Birmingham. And if you want the audio version of this, check it out on Apple Podcasts. Thank you all again and have a great day. Bye-bye.
Bye.
Bye-bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.